Boston 25 News at 10 starts right now.
Governor Charlie Baker. Governor Baker saying one of the keys to getting back to normal is contact tracing. 25 Investigates has learned school nurses have been doing some of that important work.
They've been collecting data to slow the spread of coronavirus through local boards of health. Boston 25 News anchor Carrie Cavanaugh explains how school nurses are playing an unexpected role during this crisis.
We've got these skills that we use every single day.
We manage outbreaks of contagious diseases, and we contact parents and we send out notifications.
Now school nurses from Medford to Methuen are putting those skills to use, helping their communities battle a pandemic.
Many times we're the person who tells them that their case was positive. They may not even know that yet.
Patty Comeau is the lead school nurse in Methuen.
Did you envision you would be playing such an important role?
Absolutely not.
When a person with coronavirus is recovering at home, it's upon local boards of health to track those cases. Those boards are already stretched thin, and that's where school nurses are stepping up.
I'm definitely spending at least a half an hour with each of the people that I'm calling, making sure that they are okay, that they're progressively getting better, and assessing them medically.
Medford school nurse Karen Roberto says each day she gets assigned new cases.
I'm just calling to see how you're doing.
She's supporting and advising those who are sick, but also helping them identify who they've had close contact with while contagious. All that information is added to a state database. This is contact tracing.
But it's just becoming too much for our department. So with over 300 cases, our school RNs have the experience that we so desperately need to get these contacts traced as soon as possible.
Medford Mayor Brianna Lungo-Kern says it's all about slowing the spread. And with the school nurses, Lungo-Kern says Medford has been able to stay on top of more than 300 cases in the city.
Yes, it did. It came back positive.
And Comeau says they're also providing an emotional support system to many who are sick and alone.
We're finding that this is very heavy lifting work because some of these people have loved ones that are in the hospitals on vents, in ICU, and we have to tell them that they can't go and visit them.
How do you feel personally about being able to lend some type of hand patient advocacy in this crisis?
Anything that we can do, that's how nurses are. Whatever you can do, you just do it.
I'm able to actually fulfill my nursing role, and apply my nursing skills. It definitely is a good feeling.
Governor Baker said that Massachusetts has one of the first large-scale contact tracing programs in the state. Last week, he said 176 people had been trained and onboarded, and in the coming weeks, hundreds more would be added to that. Well, 25 Investigates has learned that the school nurses want to play a bigger role in this. And in fact, this month, they sent the governor a letter stating they want to help the state. For 25 Investigates, I'm Carrie Cavanaugh.